Healthy Mothers, Healthy Babies last coffee and chai chat of the year. We are privileged to host you this today. And today we are also privileged to have two expert speakers. One of them is Wendafrash Abera, who is an advisor on food safety and nutrition, and he is from the Ethiopian Food and Drug Authority. At the same time, we also have our good friend, Dr. Clayton Ajello, who is a senior technical advisor at Kirk Humanitarian. And today, our experts will discuss the updates to the recently published expert consensus on an open access UNIMAP MMS product specification. For those who are new to the MMS conversation, UNIMAP stands for the United Nations International Multiple Micronutrient Antenatal Preparation or Multiple Micronutrient Supplements. This conversation will be based on a paper that has been recently published by Clayton Ajello and colleagues, including John Atwater, who will be joining us in the question and answer part of the coffee and chai chat. And so we will discuss some of the regulatory implications for scaling up multiple micronutrient supplementations at the national level. And these publications and the insights given by Wendafrash are going to be very helpful in this conversation. You can find some of the links to the paper in the chat. And to learn more about the Healthy Mothers, Healthy Babies program, which is hosted by the Micronutrient Forum, you can visit our website at www.hmhbconsortium.org. A few information about housekeeping for this today's meeting. Feel free to introduce yourself. You can tell us your name, your organization, and the country you are based or where you're joining us today. And please write your name and affiliation in your Zoom window. And you can turn on your video. As we always say, the coffee and chai chat is slightly different from the regular webinar, because the idea is that we are meeting in a coffee or in a coffee room or a chai room somewhere in your country, and we are just talking about MMS. And so it's a bit informal, so feel free to introduce yourself, to add some comments in the chat. All participants will be muted during the presentation, but you'll be able to unmute yourself during the Q&A and ask questions. You can raise your hand if you would like to ask a question. And we do actually prefer it if you want to speak and ask the question yourself. Even better if you can put on your video. So in addition to that, you are welcome to put your question in the chat box, and we will pick it out and put it to the presenters or anybody else in the room who can answer it. In case you have any technical difficulties, kindly send a direct message to our tech support. You will find it also in the Zoom. And please note, as you have just heard, this meeting is being recorded, and you will be able to access the recording after the chat on our website under hmhbconsortium.org/coffee and chai chats. At this point, I want to invite our first speaker, Dr. Clayton Ajello, to start with his presentation. Clayton, over to you.
Thank you, Martin. Let me just bring up the presentation. There we go. Can everybody see that? Great. Thanks, Martin, so very much. I'm really delighted to be here again today with HMHB, and HMHB has invited me to share some perspectives around the navigation of the regulatory environment when exploring the introduction of MMS. What I'm going to do is go through a number of interlinked topics and conclude with an exploration of the opportunity for national authorities to inform their sort of local regulatory environment by building on the global experience, which I'm going to sort of discuss throughout this presentation. I'm hoping that many of you are already familiar with the interactive map on the HMHB Consortium's website. It shows that there are more than 50 countries at this point that are actively working to introduce MMS, or they're exploring the introduction of MMS. The investment roadmap that's shown here on the left side of the screen provides readers with basically a roadmap for, or a pathway for, introduction of MMS in the 45 low and middle income countries that generate about 85% of the pregnancies on an annual basis. and it projects that the annual number of pregnant women that would be eligible to use MMS by 2030 will be about 100 million women. And the annual coverage that we expect in 2030, if we stay on the trajectory that roadmap suggests, or that the interactive map suggests that I just showed, will be reaching about 60 million pregnant women by 2030. In order to keep up with the demand, manufacturers are gearing up to produce this product, and they're using two approaches to do that. In some cases, there are national companies that are doing local production to serve just a single national market. By contrast, there are also producers that are producing the product as a regional manufacturer. They are high volume manufacturers that service not just the national market in the country where they reside, but also export markets. There are risks and benefits to both of these approaches, but I think from all of the experience across many, many countries now, the regional manufacturing hub model is viewed as a more effective approach for managing the volume, the quality, and the cost of MMS product supplies. Today, or actually in 2019, there were 2 manufacturers of the MMS product. Today, there are 7 across the world that are manufacturing it, and there are another 9 manufacturers that are somewhere in the process of either planning to develop, have started product development, or are actually in the process of preparing for product registration in these countries that are shown across this map. What is important is that this group constitutes probably the network of regional manufacturers that are making this product or will be making the product, and they reside, 13 of those manufacturers actually reside in low and middle income countries. With all of that global experience that has been emerging over the last 5 years, their experience really underscores the necessity for the MMS product to be standardized or interchangeable across all manufacturers. From the buyer side of the equation, they have many expectations as buyers, but the 2 that come to mind really right now are, as most important, are that there is a need for fixed quality across manufacturers and the option to procure the same product from 2 or more manufacturers that help procurement agencies to conform with their local procurement rules and or to manage purchases that have been made with multiple suppliers. In this sense, product standardization really is essential to achieve the expectations from the buyers. By contrast, on the other side of the commercial equation are the manufacturers who seek many things as well, but there are at least 3 things that are of major importance. First is clear guidance on the specification that the product is to be produced to, and having that specification embedded in an easy-to-read procurement agreement. Secondly is the ability to sell an identical product both into the public and private sector markets, and then obviously limited variations of the product because that facilitates scaled manufacturing efficiency and lower cost. Product standardization in this sense is not going to be able to help manufacturers get everything that they're looking for, but the one thing that it does provide manufacturers with that they really are looking for is a level playing field in the commercial marketplace that prevents individual manufacturers from gaining a commercial advantage from the development and sale of a substandard product that's sold at a lower price. This global experience also points in the direction that standardization is in fact being achieved because both buyers and manufacturers, by and large, are converging on the use of what is now known as the expert consensus specification shown here on the right-hand side of the screen. This is a peer-reviewed publication. It's based on globally recognized standards. It is now accepted by all of the current buyers of UNIMAP MMS. This includes especially UNICEF, Kirk Humanitarian, and the Vitamin Angel Alliance. Importantly, it can also serve as an exhibit to a legally binding purchase agreement, and as a result, the use of this specification is creating momentum toward a globally harmonized set of standards for MMS. We're not there yet. We don't have a completely harmonized set of standards, but we're moving in that direction very quickly. And by use of this agreement, this can be help to inform decision-making at the country level around the local pharmacopoeial standards and regulations. The specification itself describes all the technical standards with which the product must comply. These are listed here. We'll probably discuss those more during the Q&A session. I think the importance here is that there is no daylight across buyers of what the specifications are. Rather, the challenge now is interpreting and implementing the expert consensus specification in a consistent manner that will lead to us being able to derive the benefits that are afforded by use of the specification. And I'll draw your attention really here to the second bullet on this slide, and that is that the specification does identify the incremental good manufacturing practices, GMPs, that need to be fulfilled in order to move a product that is classified as a dietary supplement into a medicinal classification. And this is important because this document, in its guidance, says to manufacturers, you really should be producing this product as a medicinal product. We can talk during the Q&A as to why, but many people raise the issue of cost. There is a nominal cost in moving this product from a dietary supplement to a medicinal classification. To be assured that the product purchased conforms to the standards that are in the specification is very simple. You can buy this product from UNICEF. You can buy it from a UNICEF-applied supplier, or you can buy it from a supplier that adheres to internationally recognized standards and supported by independent verification. Or you can simply buy this product when it's marked with the orange USP verified mark. This is shown on the left-hand side of the screen. And this is a mark that is awarded now under a very newly created program that is being launched actually this week by the United States Pharmacopoeia, Perk Humanitarian, and UNICEF. The course of that verification, there are a number of things that are performed by USP. We won't go into those here, but they're very important to assuring product standards that conform to the consensus specification. We believe that, again, based on the experience with manufacturers across the world, that product verification is essential because the quality of products that are produced as supplement products worldwide often do not conform to globally recognized pharmacopoeial standards, and thus are sort of out of conformance with regard to their label claims. And we've done studies about this to back that up. The most important thing, though, is that the regulatory bodies tend to focus on documentation of compliance post-manufacturing, whereas the whole point of a verification program is that it focuses on helping manufacturers to build quality into the product as it is being developed and manufactured. And of course, this will help to avoid reputational risk for all the stakeholders involved in programming with MMS, and it also supports consumer confidence. You can also recognize that all donated product conforms to the specification because it will display this new universal label that's now being placed on donated product. There are three important components to this. There is the pink figure mark that combines the images of women, but it also has the UNIMAP name on it, which signifies that it is a UNIMAP formulated product. There is a word description that is newly crafted in conjunction with UNICEF for the middle panel. And then as companies become involved in the verification program, they will be allowed and given the right to use the USP verified UNIMAP mark. All of this global experience is very important because it does lead us to an opportunity now for national authorities to inform their local regulatory environment during the introduction of MMS by building on global experience. Most of the countries that are actually introducing are using a standardized pathway to introduction. I've listed the three major elements or steps in that process. I'm not going to explain those here. You are referred to the two hyperlinks on the slide here that will fully explain implementation science or a pathway to introduction of MMS. What is important for this presentation, though, is that there are key activities that are essential during each of these three steps This is not a comprehensive listing of all the activities, but some important steps. In the first step, where awareness raising and consensus building is being formed around the approach that's going to be used to secure the product, whether it's imported or locally manufactured, it is very important to determine locally what is the product classification and whether you are in fact going to explore importation, local manufacture, or some combination of both of those as a strategy. The second step that's listed here, it's very important. I can't emphasize this enough to test the acquisition options and the systems and processes that support acquisition. Even if you're unable to complete those transactions, what happens during this process is there's an identification of what are the adjustments that will be needed for the national pharmacopoeia standards, as well as the budget, finance, purchase, and distribution systems. And those adjustments are going to be important in advance of listing the product on the National Essential Medicines list, or if you have a national formulary, on that formulary. In the third phase of this model, it's very important for government officials to formalize the requirements and the processes that support national registration, and not just the national registration, but also tendering requirements that will be followed during the scale-up. I will want to have one last slide here, which notes that all of the product that's currently being donated to governments for introduction is in fact manufactured as a medicinal product. And in fact, country governments usually provide a waiver for its importation while the local regulatory framework is being considered and finalized. There are a number of summary points here. Again, I'm not going to go through all of these, but I do want to draw your attention to the next to the last one, which is that national governments really do have an opportunity now to use the consensus specification to inform their local regulatory requirements. And as a result, by using the global experience, we will move to a more harmonized state of product development. And this is very important because manufacturing will likely be largely regional. And in order to afford everyone with an interchangeable product that's equal, standardization of this product is probably going to be an essential step. So thank you. There are, at the end of my presentation, some hyperlinks for you to look at. And when we get to the Q&A session, I'm very happy to answer any questions with my colleagues. And incidentally, the third author of the specification is Jarno de Lang. I hope that he is on the Zoom meeting this morning, and he may chime in too with some comments. Thank you.
Thank you so much, Clayton. That was very well delivered, and I think also very clear. Couple of questions that are coming up as well, and I'm sure you can help us answer them when we get to the Q&A section. Folks, the reason why we are having this conversation is because, as we all know, in many lower middle income countries, since 1959, when WHO started recommending iron and folic acid for pregnant women, we have not had other alternatives to give with pregnant women. But now we do have multiple micronutrient supplements. So many countries are now thinking about how to transition from iron and folic acid to multiple micronutrient supplements. And therefore, then we land into this conversation of how do we onboard it into a country. So we will hear in the Q&A section, you can ask all the questions about that you may be having. But the next speaker is going to give us the example, or rather the experience of Ethiopia. He is from the Ethiopian National Regulatory Body of Food and Drugs, so the Ethiopian Food and Drugs Authority. And this is under the Ministry of Health. And this authority is responsible to ensure the quality, safety, and or efficacy of medicines, foods, and cosmetics, and medical devices in Ethiopia. So I now welcome Wendafrash Abera to talk to us about how Ethiopia goes about registering foods. Wendafrash, over to you.
Okay, thank you, Martin. Good morning, good afternoon, and good evening, all participants. I'm very happy to attend this meeting just to share you with how food registered, especially MMS products registered in Ethiopia. So my presentation is focusing on overview of food registration in Ethiopia, specifically different food supplements and MMS products specific. Next, please. Next, please. Okay, when we say it's food registration, it is a market authorization. Any food item which are imported to the country or locally manufactured, prior to presented to the market, it must be registered or notified. This means all food products which are manufactured locally or imported to the country, just to know the safety and quality of that product, the regulatory body prior to presenting to the market, it must be registered or imported, notified. Next, please. So for the registration purpose, we are registered the products, those highly risk products that like baby foods, food supplements, processed animal products, seafoods, processed fruit and vegetables, therapeutic food, complementary foods, and fortified foods are registered. The difference between food registration and notification is when we are requiring the registration process, we need a lot of documentations because we have to know the detail about the nature of that product. So we categorize the products, the high risk and low risk products for the registration purpose. Next, please. So low risk products are notifiable products. In notifiable products are categorized as a low risk like crackers, snack foods, fats, packed water, soft drink, beers, extruded products, and noodles. Such type of and different non-perishable product or low risk food products are notified nationally as a food registration during the food registration process. Next, please. So this is the main difference. When we see the registration process, anybody who manufactured or imported these high-risk products, they have to present the following documents: the certificate of analysis, the good manufacturing practice certificate, the free sale certificate, the sample of the product, list of ingredients, and shelf life or stability study report. Both real-time and accelerator time is required because as far as the product is very risk and the consumers are highly might be vulnerable groups like infants and pregnant women, children. So we have to know about the product's nature in detail. So registration is mandatory for those highly high risk products. When we come to low risk products, notification only the importer or the manufacturer should have a certificate of competency and just present the sample or the label of the product, presenting this sample and label of the product is enough. So we currently are registering nationally in Ethiopia high risk products with pass through registration process and low risk products pass through notification process. Next, please. So when we come to next, yeah, thank you. When we come to the MMS registration, just to say, is MMS a food supplement or a medicine? Because one of the challenge we face currently in Ethiopia is some food supplements, they are food supplements, but they are claiming in their label as a medicine. But nationally, Ethiopian government in Proclamation 1112/2019 clearly stated what food supplement means and what medicine means. So to register MMS product, we have to see the definition of a food supplement and a medicine. Based on this definition, we can categorize are we registered this product as a medicine or as a food supplement? The food supplement means a concentrated source of vitamins and minerals prepared in a dosage form intended to supplement the normal diet. This is the main purpose of the food supplement. So there is no any treatment with that food supplement. There is no any diagnosis or cure. So if it is support for just for the intended supplement of a normal diet, it is categorized as a food supplement. In the proclamation 1112, article 2, sub-article 8 and 9, it is clearly indicated. So medicine means a substance or mixture of substance used to diagnose, treat, mitigate, or prevent of human disease or disorder. So such type of claiming is there. So we are defined this product is as a medicine. So just we have to refer what the manufacturer claim on that product. If the manufacturer is claiming that the product is used only to the normal diets or to supplement the normal diet, so it is categorized as a food supplement. Let us see the products which are registered currently. Next slide. Yeah, the other thing, the main difference between the medicine and the food supplement, just to give you a highlight, is if it is a medicine, it is a tax-free. The government is not taxed that medicine. But if it is a food supplement, there is a tax. The other thing is, if it is a medicine, the good manufacturing on-site inspection is mandatory, except those stringent regulatory authorities like North America, EU, Japan, and some other countries. We have a strategy for the registration purpose of a medicine. So it doesn't mean that it is easily imported, but we review the dossier, we refer some documents, certificate of analysis, and other things, but we are not conducting on-site inspection. But when we come to the food supplement registration process, they may not be need on-site GMP inspection, or they may be. It is not a mandatory. So on-site inspection as deemed necessary for GMP compliance of the factory. The other thing is, if it is a medicine, it should be prescribed. Unless otherwise, it is over the counter, the product. Of course, we have a list, those products which should be sold over the counter. Unless it is not indicated in that list, it must be prescribed. But when we come to the food supplement, no need prescription. The other thing is promotion issue and advertisement. Medicine is not promoted or advertised. Of course, medical representative, pharmacists, they promote the product one-to-one to the physicians, not in the public. There is no advertisement on the medicine products. But when we see a food supplement, we can advertise in accordance with the food advertisement directive. The government have a food advertisement directive, so we can advertise this product. The other thing is, if it is a medicine, there is a dosage as recommended by pharmacopoeia. But when we see the food supplement, we refer at national or international recommendation. As international recommendation, we are using a codex standards. The other thing is the label claim. The label claim is a medicine, but if it is a food supplement, that food supplement should be labeled that the product is only a food supplement, not a medicine. So the label claim also difference. Next, please. Okay. Yeah, currently totally registered product. Yes, in the slide you see 6,924, but the recent data is 7,147 products are registered and notified, out of which 451 are a food supplement. So let's see the list of or sample of some food supplements which are registered by the EFDA. Folic acid with vitamin B12, 400 micrograms, multivitamin and multiminerals in tablet form, iron and multivitamins in liquid form, prognathed capsule in capsule form, and iron folic acid, 800 milligram, vitamin C and zinc, a chewable tablet. All these products are registered currently in Ethiopia as a food supplement. So we can define whether the MMS product is related to this product or different. We can define it. Anyways, in the next slide, we will see where MMS product, the country categorize it. Next, please. Yeah, this is a new thing which I wanted to share with you. Yeah, currently, the government of Ethiopia, the Minister of Health revised its current essential medicine list on October 2024. It is a month before. In this medicine list, vitamin B12, minerals, multi-micronutrient powder in sachet containing with iron 12.5 milligram, coated ferrous, zinc with 5 milligram, and vitamin A 300 micrograms with or without other micronutrients recommended as essential drug list. So multi-micronutrient powder, the government of Ethiopia is categorized this product as a medicine. Not only this one, it is currently revised a month before. Previously, they are categorized as a food, F75 powder, F100 powder, ready-to-use therapeutic food, RUTF, oral paste, bar or liquid powder, standard formula, with minimum 500 calories per 100 gram. All these products are categorized currently as essential medicine list. So why we are doing this is because these products are therapeutic character. Of course, they are food, but they are using for therapeutic purpose. With the request of especially the WHO and the health sector, and with the advantage of the public health, especially children with malnutrition, with mothers and children's health care. So the government of Ethiopia currently categorizes these products as a medicine, and they are found in the medicine list in the indicated standard or indicated status. So this is the current, especially the new information which recently endorsed by the government of Ethiopia on October 2024. Maybe it will be, it is already endorsed. The launching process also on the way. And recently, maybe this document is published. You can find in page 21, especially the vitamin and minerals, the multi-micronutrient powder, and I think page 26, page 37, the therapeutic foods also indicated. Those are, especially these therapeutic foods are added recently as a food supplement, as essential drug list, essential medicine list. This is the currently which I have. Okay, next please. I think with this slide, I will finish it. So what is the challenge? The challenge in all this process is those border products, borderline products. Some products are on the border. We are speaking it is therapeutic food, but we already categorized as a medicine. This is what the challenge. Of course, the proclamation says that thing is clearly indicated what medicine means and what food supplement means. But with a special condition, we can see such editing. And the borderline product is one of the challenges. The other is the laboratory capacity, the human power capacity, testing, reference standard for vitamins and minerals. This is a challenge what we face currently in Ethiopia during the importation process. We are conducting a consignment test. So during this consignment test, we face some challenges related to the testing. The other thing is a technical document. The manufacturers cannot supply the stability study, the shelf life study, real-time and accelerated for the doser evaluation. We are requiring this document, but they are not presenting that one. That is the main challenge. The other thing is the product standard. Sometimes, you know, products are manufactured with a special recipe, with special requirements. So there is no standard. But during this condition, we are referring codex, the acceptable intake limit, like that. And the professional capacity and product label claim are the challenges. This is what I have. I wanted to, which I share with you concerning the food registration, especially the MMS product. Thank you.
Thank you very much, Wendafrash. Always nice to hear from you. A very clear, very well delivered presentation. And congratulations to Ethiopia FDA for registering, you know, the products that you have just shown: F75, F100 micronutrient powders. This does mean that the Ethiopia government considers these products to be clinically important, considers them to be important to have high priority access, and you know that they have followed all manner of local guidance. So the next part of the webinar, we are going to, of course, request anybody who wants to ask a question. You can unmute yourself. But when you're not asking a question, kindly keep yourself mute so that we can hear each other. And perhaps Tech, you can help us mute. I can hear a background noise. I want to start with Clayton. Clayton, somebody asked about UNIMAP, and why do we talk about UNIMAP versus just regular MMS when we are talking about antenatal interventions for, you know, for public health? Perhaps we start with that simple question of you know, unmasking the difference between just UNIMAP versus a regular MMS that they can buy everywhere. We saw a lot of products in Abera, Wendafrash is the slides that could be probably just regular MMS. Perhaps as you answer that.
Yeah, sure. Yeah, sure. It's a good question. This is the reason why the UNIMAP mark is important, because it is distinguishing itself from all of the other products that are on the market. An MMS product is loosely any combination of minerals and vitamins. It can be as few as just iron and folic acid, which is considered to be an MMS product, or it can be multiple ingredients. The UNIMAP MMS product has 15 ingredients. And the reason why the distinction is important is because the UNIMAP MMS product is the only product that has undergone clinical trials extensively in multiple country settings and has been demonstrated to everyone's satisfaction that it is effective, it's safe, and that it has the demonstrated effects on pregnancy outcomes that have been described. So it's the clinical trial difference that makes the difference here. And if one wants to be assured of the outcomes on the population, one should be using the one product that has been demonstrated clinically to do that.
Thank you. And while you are still at it, and feel free to call upon your fellow co-authors of your paper to answer if you need be. Following on what Wendafrash just presented, is it more advantageous for a country to classify a UNIMAP MMS as a medicinal product compared to a dietary supplement? What are the advantages and disadvantages of each, very shortly, from where you sit? And if you would also indulge us, is there guidance now available to countries about how they should classify MMS? I know I've packed it in a lot, but hopefully you can unpack it.
Yeah, let me offer a couple of thoughts. First, it depends on the perspective. If you are from UNICEF's perspective, they want to have a pharmaceutical classified product because it's easier to import that product into a country, irrespective of whether it's classified as a pharmaceutical product or a dietary supplement. So there's a practical consideration from UNICEF perspective, which is one of the larger providers of this product worldwide, or will be one of the larger providers of this product worldwide. I think from a manufacturer's perspective, we hear often that they would prefer this to be classified as a dietary supplement product because it's less expensive to make. There is some truth in that, but if a manufacturer is selling into the public sector, they are recommended under the specification that's just been released to manufacture this as a pharmaceutical product, because they are probably already using USP, or should be using USP pharmacopoeial standards to manufacture the product. And if they move the product from being classified as a dietary supplement when they are using USP standards, the cost of reaching the additional or incremental standards for good manufacturing practices that UNICEF requires, then the cost is nominal. So for all practical purposes, while it may be slightly more expensive to manufacture this product as a medicinal product, it's probably better from a regulatory standpoint to use this as a medicinal product. I don't know if John has any comment on that. Obviously, this is a question that's up to the local governments to decide what they want to do. But as a general recommendation, probably when you balance out all of the things, it's fine to move this to a medicinal product.
Clayton, I certainly have some comments. Clarify Clayton's comment about there's some background noise.
Sorry, just if you're unmuted, could you please mute yourself? Somebody else we have some noise for the background. Thank you.
I think it's okay now. Clayton mentioned about the nominal cost of moving from a dietary supplement to a pharmaceutical product if they're following USP standards. And it's really important to be following USP standards. And I'll comment a bit further on that with a question that was asked in the chat. But in order to move from a dietary supplement to a pharmaceutical product following USP standards, really there are only a couple of things that would need to be added to a manufacturer's operation to do that. And that would be to have a quality manual, to have a quality risk management program, to have a validation master plan, and to perform both manufacturing process validation and validate the cleaning process of the operation, of the manufacturing operation. There was a question about, if a product is following USP, does that reduce the testing cost? Not necessarily. The nice thing about the USP standards is that in the monograph, it's called oil and water-soluble vitamins with minerals tablets. That's a mouthful. It provides all of the test methodology that can be applied to the Unimap MMS product. So that, and those are validated test methods. So it really eliminates the need to have to go through the method validation process. All you have to do is method verification. In terms of testing, if a product is undergoing the USP verification program, that product will be tested on an annual basis. So, if a government is interested in making sure that the product will comply with its quantitative label claims throughout the shelf life of the product, if it's USP verified, that should allay all their concerns. I think that addresses those questions, but if not, let me know.
It does. It does. Thank you very much. And I know, Wendafrash, I want to call on you. Perhaps as I request Naoko to unmute and ask, someone has put a question in the chat. As they are doing that, I would like to ask you to reflect on what John and Clayton were just speaking about. At a national level, what do you see as for example, how long does it take when a manufacturer says, I want to register as a supplement versus when I want to register as a medicine, which is the easier process? And also, when is it better in this case, we are talking about pregnant women. When is it better in terms of access versus cost to the product?
Yeah, let's start from the last question. Concerning the access, I think it is better when it is registered as a medicine, because it is very easy. The product might be imported without any tax, so the price might be less. And at the same time, the government may support these issues and import through the government side. So to create an access to the pregnant women's and for the advantage of public health and mother and child health, I think it is categorizing to the medicine size is, I think it is better, it is good. Concerning the registration process, of course, when it is as a medicine, the registration process might be long when comparing to the requirement of food supplement. But as far as it is essential medicine list, there is a priority of registration for essential drug lists. So it doesn't face any problem related to the registration process on medicine product, because they are in the priority list. So they can get a priority to register, so there is no any problem. The other thing is from where that product is coming. As I mentioned in my presentation, especially for the SRA countries like EU, and especially where there is stringent regulatory authority, we are only focusing on the sample testing. Maybe on-site inspection, we are not conduct on that issue. So it doesn't take any delay or long process for the registration of essential drug lists. But for the advantage, I think it is more advantage. The other thing which is raised concerning the manufacturing process, the product might not be manufactured, especially in medicine manufacturing facilities. They may be because, let's take, for example, RUTF, F700, F75, F100, they are producing in food manufacturing facilities. So the only thing is that manufacturing facility should comply good manufacturing practice, GMP certified or HACCP certified facilities. But the product might be produced in food manufacturing facility.
Right, right. And related to this conversation, I want to ask Naoko to, if possible, put on your video and follow up this conversation with Wendafrash. I think he or she had a question for you. Naoko, over to you.
Sure. Yeah, thank you so much for this discussion. It's been really, really informative. So I have 2 questions. I think the first one was previously answered in the chat, but I'll just ask that again. So I was kind of curious how MMS has been classified between medicine or supplement currently in most countries. And then the second question that I had was, in the presentation, you talked about product standardization that extends to labeling. But, for medicines, pharmaceuticals, a lot of countries often have their, labeling requirements for medicines, especially, for non-donated products. So I'm wondering if you can comment on whether, you see a similar trend for MMS, essentially countries, preferring more customized labeling. And curious to hear how you're balancing, sort of preserving the benefits of wide range product standardization, but also, responding to country-specific requirements in terms of labeling. Thank you.
Thank you. I think Wendafrash, you are off the hook because the first part of the question you had just answered it. So I think let's move to Clayton to answer the second part of the question. So in the interest of time.
Okay.
Clayton, over to you.
Just to reaffirm what I put in the chat was that the MMS product globally, most countries are classifying this as a pharmaceutical product by the local authorities. With regard to the label, yes, there is a standardized label, but within the product specification that's just been published, there are options for how the product gets labeled when it is being paid for by local organizations, and all of the components of what goes into that. For donated product particularly, that is from this point forward going to be using one single universal label. There is an option that's coming very soon for the use of QR codes, so that there can be multiple languages for the product label on a QR code. From the donor perspective, the reason why a universal label is being used and will not be changed is because it's simply cost prohibitive. If you are running, if a country is asking for, during their introduction phase, for 100,000 bottles, it's quite expensive to change the label. It takes time to change the label. It's not a very efficient way to manage this. As countries purchase this product through the Child Nutrition Fund, my understanding is that there will be options at some point, depending on the amount of product they're buying. If they're buying more than 50% of the product, it is likely that the national authorities will have an option for having a customized label for their national program. And certainly if they're buying continuously for the national program, I'm sure that they'll be making a provision from that. But it's not a very practical thing to keep changing the label, although we completely understand why governments want to move toward a standardized, a label that's customized for their country.
Right. And Wendafrash, if you allow me, there is a question that Girma Goshime had asked in the chat. I was trying to get Girma to ask the question. Girma, are you there? Do you want to ask your question, or do you want me to read it out? Girma, if you're not there, Wendafrash, the question was about the advantages and disadvantages of registering MMS in the essential drugs list, as you mentioned, in Ethiopia. That's also happening. And is now, Girma was wondering, are the products registered in the essential drugs list now going to be available over the counter or as prescription drugs? Could you comment on that?
Yeah. Specifically, there is those products which are listed in essential drug, it doesn't mean that it is over-the-counter product. So for that purpose also, there is a guideline, there is a directive, especially over-the-counter products. So some products might not be essential drugs, but they are selling as depending on the product availability or the product nature, they can sell over the counter. So not yet decided this product is whether this product is over the counter or not recently, because there is a different guideline for that purpose also.
Right. So coming back to, thank you for that, Wendafrash. Coming back to Clayton and the colleagues, there is a question about manufacturers who would like to manufacture Unimap MMS. How can they access the latest updates and requirements to produce high quality MMS product? And are there, sensitization workshops that designed or organized to update them, or training materials? How does this normally happen, especially for the manufacturers who have already managed to start manufacturing MMS in LMICs, as you mentioned?
Yeah, a good question. So up to this point in time, manufacturers have been identified by a small group of us in the donor community. We actually have gone out and done pre-qualification of manufacturers around the world. I think probably from this point forward, where there is manufacturer interest, they should simply contact us. If they want to know the specifications, they can go online to the Annals of the New York Academy of Sciences, which was previously put, I think, into the chat box, to get a copy of the current consensus specification. Once they understand what the specification is, they have to then decide whether they can manufacture this at an efficient way to compare themselves with globally available pricing for the product. And that would mean that they would have to be a high volume manufacturer. It does not at this point, although I know a lot of countries do want to try to manufacture this product, if they are not manufacturing at least 1 million bottles a year of 180 count, or the equivalent for that number of pregnancies, of 1 million pregnancies, they're not going to be able to get to the manufacturing efficiencies to make it a cost-effective and profitable venture for themselves.
And by the way, following on that, and thanks for that, how can countries that do not have a manufacturing base ensure then the supply of a standardized, high-quality Unimap MMS product? And while you are at it, is there a role for regional manufacturing hubs? If yes, what is it?
Yeah, well, there certainly is. We think most of the product will be supplied by regional manufacturing hubs. Kirk Humanitarian and UNICEF are working collectively to try to qualify all of the regional manufacturers in the USP verification program. That's one way to assure the standardization. Manufacturers can work directly with UNICEF to become an approved supplier. There are a lot of avenues for getting to where they need to be. But from the buyer perspective, as I said in my slides, government should be purchasing from one or more of the existing regional suppliers of this product. And as they become USP verified, you'll have a much wider range to buy from. But there are a lot of manufacturers now. This was not the case 5 years ago. Today, there are a number of manufacturers that make a high quality product, and they should be purchasing from them.
Excellent. Thank you very much. This has been very helpful, and I think I want to give each of you maybe 30 seconds for your closing remarks. And as I come back to Wendafrash for your closing remark, could you also add about the cycle of the essential medicines list? How long does it take if you start now to consider adding MMS to the Ethiopian essential medicine list? How long does it take until when you can have it added to the list, and then you can add your closing remarks, and then after that, Clayton and colleagues.
Okay, thank you. Yeah. Concerning this essential drug list revision process, in 2021, the 6th edition was issued, and almost 3 years back. So it takes a long process because there should be to conduct an assessment, the gap assessments, and consulting different stakeholders and participating, discussing on that issue. So after 3 years, in 2024 now, the 7th edition is revised. So currently, I think it is more good, especially considering the public and the problems, the public health problems and the advantage. So this is what.
Thank you very much. Thank you very much, Wendafrash. And it's a pleasure always having you on board, and we will always learn a lot from you. And we look forward to learning from you in the future. We might call on you again. Clayton, over to you for your closing remarks.
Yeah, thank you, Martin, and thanks for the opportunity today to share all of this with the audience. I would say that the most important thing, taking a 50,000-foot view of all of this, is that governments that are introducing or exploring the introduction of MMS, they need to pay attention very early on. They should not just be looking at what's the most effective strategy for delivering this product to patients, or to pregnant women. What they should also be looking at, what is the most effective strategy for securing the product. And that process is probably a 3 to 5 year process. So it has to be synchronized with the service delivery component. And obviously, there are a lot of resources to help governments figure out how to secure that product. We will be publishing lists of approved suppliers in collaboration with UNICEF. And we would say you should start by looking at the specification that's just been published, and that will give you a good idea of what your national regulatory environment might want to look like. So thank you.
Thank you so much, Clayton, and all our speakers as well, and all those who answered questions in the chat for this conversation. It's very helpful because in the nutrition community, we focus a lot on giving interventions, and we usually don't have a lot of opportunities to hear about how these interventions are not only manufactured, but also put into our pharmacies and our nutrition care centers. So with that, I want to thank everyone else for joining the chat today. It was very helpful. We are going to share the recordings of this chat, so stay tuned for the next chat, which is going to be in the new year. And if you would like to join the Healthy Mothers, Healthy Babies Consortium, please apply to become a member. There is a link in the chat that you can click and join us. To know when we are going to have the next Coffee and Chai chat, just follow us on Twitter, or rather X, or via the Micronutrient Forum pages, or on LinkedIn, and you can also sign up to for the Micronutrient Forum newsletter to be updated. With that, thank you very much, and till the next year, we wish you happy holidays and a happy new year as well. Let's meet in 2025 for a productive year.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Thank you. Bye.
Thank you.